In this session of GPAT KAKSHA, we will learn about actions of adrenergic system. The action of adrenergic system on eye is mydriasis, contraction of radial muscle of iris due to alpha-1 action. Alpha-1 receptor agonist leads to contraction of radial muscle of iris, which thus leads to mydriasis. Beta action leads to increased secretory activity of ciliary epithelium and thus leads to increased formation of aqueous humor. Means beta receptor agonist or stimulation of beta receptor leads to increased secretion inside the eye, hence increased formation of aqueous humor. Alpha action leads to decreased secretion and thus decrease in formation of aqueous humor. Means by stimulation of alpha receptor, the formation of aqueous humor inside the eye or the secretions inside the eye decreases. So in glaucoma, where the intraocular tension is high, due to accumulation of secretion or fluids inside the eye, beta antagonist and alpha agonist are useful. So in treatment of glaucoma, beta antagonist and alpha agonist are useful because alpha agonist will lead to decreased secretion, so the intraocular tension will decrease, and beta antagonist will produce effects opposite to that of beta action, that is decrease in secretory activity, hence decrease in intraocular tension. On heart, all the actions are mediated by beta-1 receptor. Beta-1 receptors mediate all the actions of heart in case of adrenergic system. The actions are increase in force of cardiac contraction, means the force by which heart muscles contract to pump the blood outside it. That particular force increases, so that is known as positive ionotropic action. Increase in force of contraction is known as positive ionotropic action. Beta-1 receptor stimulation leads to increase in heart rate, that is known as positive chronotropic action. Chrono means a rhythm. So increase in heart rate is known as positive chronotropic action due to stimulation of beta-1 receptor. Increase in rate of conduction velocity through AV node, ventricular fibers is known as positive dromotropic effect, means increase in the conduction, the action potential impulses, the conduction impulses through which the heart gets regulated and the heart wall contracts and get relaxed. By the virtue of that particular impulse, the conduction of that impulse is increased, and that is known as positive dromotropic effect. So the overall action on heart is increased in force of cardiac contraction, increase in heart rate, and increase in conduction velocity, that is positive ionotropic, positive chronotropic and positive dromotropic action, and these all actions are mediated by beta-1 receptors. On blood vessels, beta-2 receptor stimulation leads to vasodilation, whereas alpha-1 and alpha-2 receptor leads to vasoconstriction. So beta-2 receptor leads to vasodilation, beta-2 receptor stimulation leads to vasodilation of blood vessels, whereas alpha receptors leads to vasoconstriction. You can remember it as alpha leads to contraction and beta leads to dilation. So you can remember it like ABCD. So alpha receptors leads to vasoconstriction, whereas beta receptors leads to vasodilation. On respiratory system, By stimulation of beta-2 receptor, bronchodilation occurs. Beta-2 receptors are present on the bronchus, and by stimulation by beta-2 agonist activity, bronchodilation results. So, beta-2 agonists are used in treatment of asthma because they leads to bronchodilation. Relaxation of smooth muscles of GIT occurs by action of beta-2 and alpha-2 receptors. Means the action of adrenergic system is that of relaxation of smooth muscles of GIT. On bladder, hindrance in micturition by relaxation of detrusor and constriction of trigone. So, relaxation of detrusor muscles and constriction of trigone by alpha activity. Relaxation of detrusor occurs by beta activity, and constriction of trigone occurs by alpha activity, which leads to urinary retention and hindrance in micturition. This is the bladder, and these is the detrusor muscle. So, relaxation of detrusor muscles takes place by beta-1 action, and constriction of the trigone part takes place by alpha action. So, combinedly these two activities will lead to urinary retention or hindrance, provides hindrance in micturition. On metabolism, beta-2 stimulation leads to gluconeogenesis and glycogenolysis, thus hyperglycemia. So, the beta-2 receptors stimulation leads to hyperglycemia, that is increase in blood sugar level by gluconeogenesis, means synthesis of glucose from non-glucose molecules such as ketones etc. is known as gluconeogenesis, and glycogenolysis. Glycogenolysis means breakdown of glycogen. So, beta-2 stimulation leads to gluconeogenesis and glycogenolysis, thus hyperglycemia. Another action is hyperkalemia, that is due to release of potassium ion from liver, and that particular hyperkalemia is followed by hypokalemia. Hypokalemia means decrease in potassium level in blood because of uptake of that released potassium by skeletal muscle. Initially hyperkalemia occurs. Hyperkalemia means increased amount of potassium ions. That occurs due to release of potassium ion from liver, and that is followed by hypokalemia, that is decreased in blood level of potassium due to uptake by muscles. For practicing MCQs and to learn important one-liners, follow GPAT KAKSHA on Instagram. The link of same is given in description. Study well, keep yourself motivated, always keep smiling. Stay tuned for next topic, that is adrenergic drugs. Thanks a lot.